the James in the last year has cared for patients in all 50 states.
Wow.
And, almost 100 countries around the world as well. That happens through a variety of mechanisms.
This is the James Cancer-Free World podcast. I'm Steve Wartenberg, and my guest is Dr. David Cohn. Dave is a gynecologic cancer surgeon and the chief operating officer and chief medical officer of the James. In recent years, the James has made it easier and faster to connect people throughout Ohio and even beyond with its large world-class team of cancer experts. And this is really important because access, screening, and early diagnosis all lead to better outcomes and save lives. Dave has been a leader in this area, and he will fill us in on some of the many programs he has helped initiate here at the James. Welcome back to the podcast, Dave.
Thanks, Steve. Great to be here.
So a lot has been going on this past few years, a lot of buildings and new programs, and it seems in talking to people, so many of them are determined to make access easier, to serve underserved populations, to get people in quicker, so before we go into the programs, why is that important, to get people in quicker and to reach out to even more people?
Yeah, thanks for starting at that position, because I think that's really the key to this conversation is the why. What we know about cancer is that the best cancer to have is the one you never develop, and that gets to the screening and prevention side. But if you are diagnosed with cancer, the earlier that it's identified, the earlier that it's treated, then the highest probability of having a successful outcome and cure. And I think that's all that we can think about when it comes to access for patients. It's earlier screening for patients, making sure they've got that access, prevention strategies when appropriate, and then earlier into the system to ensure that their care is optimized to focus on cure.
Okay, that makes perfect sense. So let's start. Which program do you want to start with?
Wow. The portfolio is pretty broad. So let's start with, kind of what we're doing here centrally in the James. And the way that I think about it is in Columbus, Ohio, we have the James Cancer Hospital. Outside of the James, we've got ambulatory clinics that are kind of within Columbus. Then we've got an outside ring within the suburban ambulatory locations. That's another area of access. We have our James Cancer Network that's outside of there. And then we've got the region, the country, and the world. And so starting, I think, at the center might be a good place to start.
Okay, so if I understand it, the center is right here where we're sitting on campus in the James. The next outer ring is your own facilities, and then with your joint programs with other hospitals around the state.
Yep, it's a great way to think about it.
Okay, so it's concentric circles getting bigger and bigger, including more people.
Yep, that's exactly right. So when you think about the James, the first thing I want to mention is that we are today recording just before the opening of the new tower. The new tower is the new inpatient hospital at the Ohio State University Medical Center, which is going to include 148 new beds for cancer patients. The reason why that's important is that on any given day, there are about 30 to 40 patients that are literally waiting to get into the James, either in our emergency department waiting for a bed or at an outside hospital waiting to be transferred in. And so we have a demand for services that exceeds the ability to provide that care. And so in a couple of days, when we open up the new tower, we're going to begin that process of increasing the beds so that we can serve more people that trust us with their cancer care.
So how many beds are there in the James right now?
Today, there's 378 beds.
And you'll have another
148.
Can you do the math in your head?
I cannot do the math, but it's north of 500.
It's over 500. Yes, it's over 500, which sounds like it's an amazing, really high number, but cancer is so prevalent that, like you said, you have people waiting to get in.
Yeah.
And the more beds you can provide, that means more people will get expert care.
And again, I just want to make the comment that my goal is not to have the biggest cancer hospital in the country. My goal is to have the smallest cancer hospital in the country. I want to convert our buildings into aesthetic plastic surgical services or something like that, because treatment of cancer is one side of the business, but the more important one is actually the prevention and screening of cancer as well.
Okay. And let's talk about that. Where do you want to start with that? Perhaps continuum of care is a big area that I don't fully understand, but I know is important and is a big commitment.
Yeah. So when I think about the word continuum, it's end to end. Inpatient hospitalization, like we talked about, is actually a small portion of the end-to-end cancer journey. So when I set up what the continuum is, it is before someone is diagnosed with cancer. That's on the prevention side. It is the screening for cancer to pick it up early. And then it's the diagnosis side of it, treatment, some part of it. And then it's the survivorship afterwards as well, and all the care that goes with that. So when I think about the continuum, there are a couple things that we've done that really ensure that we're considering all of those components of cancer care. Number one is getting out to the community for screening, for example. We have assets, things like the mammography van that go out into communities, whether they're urban or rural, to make sure that patients that might not otherwise have access to breast cancer screening have access to that. We just opened up our lung cancer screening van as well, or a lung screening van, such that people that are at risk for having lung cancer can gain access to low-dose CT scan.
So these go to places where they don't have those facilities, Appalachia,
That's
things
exactly
like that.
right. And so we know that of the 88 counties in the state of Ohio, there are about 65 of them where it's considered that greater than 50% of all the patients there live in a rural area. So rural care is a real thing. And we've made a commitment that we want to serve the entire catchment area of the state, which means we've got to take our services to those locations because we can't put a James Cancer Hospital or an ambulatory facility in all those neighborhoods. So we move out to where they are, where they live, where they work, and make sure that they're getting access to screening.
Because there may not be mammography machines and lung cancer screening machines in some of these rural areas within 50 or more or 100 miles.
That's correct. And what we do know about certain populations is that their access to care is severely limited, either because of child care needs that they can't leave their children, they have work requirements, they might have limited mobility or access to transportation. And so all of these factors together ensure that we meet the patients where they are.
As you mentioned, early diagnosis is the key. So what are you doing to get more early diagnoses?
Yeah, and so we realized during the pandemic that as many hospital systems or ambulatory locations had shut down, we wanted to make sure that we were serving our community in the diagnosis side as well. And so we opened up our James Cancer Hospital's Diagnostic Center. What that means is that patients that think they could have cancer or a provider that's concerned that they might because of symptoms or x-ray findings or lab tests can get access to a clinic where you can actually check in, get evaluated, have the appropriate diagnostic testing done, make a diagnosis. If it's not cancer, wonderful. You can go back to your regular community. If it is cancer, then we would talk about coordinating care either at the James or in their local community to ensure that we expedite the process of getting them hooked up into the system.
Now, how would that work if either a physician was concerned the patient might have cancer, or a person without even going through a doctor thought there was a problem, it had a lump or something? Could they just call a number? They go to a website? How do they get connected to your diagnostic center?
Yep. So we know that at the James line, the main number for the James, our team there understands who should be hooked up into the diagnostic center, or there's a website as well that directs you there. So there's lots of access points, but a patient or a provider can call or go into the website directly to get that coordinated.
How quickly does it work?
Well, we can very often get people in same day, next day. It's funny, we find that while we make that commitment, sometimes patients can't come in for a week or so.
Yeah,
so sometimes
true.
The appointments are actually earlier than they want it to be.
That's true. I've noticed that too. When I call for an appointment, sometimes it's like you'll have things booked the next 3 days, but I don't know if it was about cancer. I think I would cancel everything else and come right in quick. So you mentioned that with the new addition of the new beds, there'll be more than 500 beds, but really more patients are treated on an outpatient basis, many more than that 500, and many live at home and receive care at home. So how do you reach out and stay connected to your, I'm guessing, thousands of patients who are at home?
Yeah, it's a great question, Stephen. I think it really highlights the fact that the care continuum doesn't stop in the walls of a medical center. It extends to someone's home. And so what that means is that we want to figure out a way that we can stay in contact with patients after they get chemotherapy infusion or a surgery, or if they're discharged from the hospital. And so we've made a very large investment in our what's called Remote Patient Monitoring Program, or RPM.
RPM. Okay.
RPM. What RPM stands for is, what it means is that there are devices that you can wear: a Fitbit, blood pressure monitor, a pulse oximeter for the amount of oxygen in the bloodstream and your pulse, as well as a scale. And all of those vital signs can be obtained, and then they're pushed back to a central location back in the James, where we've got 24/7 nurses that are monitoring what's happening with their patients when they're in their home environment. So they don't have to call to say, I think something's wrong. Sometimes now we will call them and say, you've met certain triggers that make us a little concerned. How you feeling? What's going on? And the second part of it is that patients also have an app where they're able to signal in how they're feeling on a regular basis, which is another trigger to the nurses.
Wow, I hadn't thought of that, but this is a great example of how technology is really helping. What would be an example of something you could detect through the technology that would make you call a patient or want them to come in?
Yeah, so there's a couple things that are really important. Number one, there's pretty good data that if step counts start to decline beneath a certain threshold, or the delta or the change from day 1 to day 2 exceeds a certain threshold, that those patients are at a much higher risk of having some type of a complication.
Because they're less active, you can tell they're not feeling well and not moving around as much.
Exactly right. So that's one of the first things, is you kind of just lead to a sedentary existence, and that's a harbinger of the next thing happening of a complication, sepsis or infection. The second thing is that sometimes pulse rates will rise before someone feels anything. You might not feel your heart fluttering or your pulse rising, but we can pick that up. And if that were to happen, then that would signal that maybe we should give them a phone call and check in to see how they're doing.
What is a faster pulse? What can that indicate?
It can mean that your heart is working faster than otherwise it would, which could be an infection. It could be some type of strain or stress in the environment as well. It's your body just signaling that it's got to do a little bit more work to pump the blood around to be able to compensate for something else that's going on.
Would the heart beating slower also be an issue?
The answer is yes, but that's not usually what you see in an acute situation.
Happen. Wow, I hadn't being a non-doctor, I would have thought a slower heartbeat, but that does make sense. Now that you've explained it, I see why a faster heartbeat is the issue.
It's like when you exercise, your body is compensating for the bigger demand that your body is telling your brain that you've got to distribute blood and oxygen, and then your heart rate rises.
Oh, do you get problems where people are exercising and their blood rate goes up, and you can think there's a problem, but they're just exercising?
Yeah, that's probably true. Usually that wouldn't be a trigger. They're not typically going to be exercising with their pulse oximeter on, but it's an interesting idea. And I'll tell you something, if a patient is exerting themselves with exercise, I'm pretty happy about that. Okay. That's a great sign that they're doing okay.
All right, that was a great start. We're going to take a quick break, and when we come back, we'll hear about a few more things you're doing to get people in here faster and reach more people.
The best outcomes for treating cancer come from early detection and early diagnosis.
The James Cancer Diagnostic Center at Ohio State
is designed to provide rapid evaluation and a clear diagnosis.
We are transforming care by giving patients direct access
to cancer experts who study and treat cancer every day.
If you think you have cancer, the choice is clear.
Choose the James Cancer Diagnostic Center.
We're back with Dave Cohn. Let's talk architecture, buildings. I've noticed there's new James buildings in New Albany and on the West Campus. So explain a little the strategy and what is coming next.
Yeah, so it seems like our expertise is in architecture, building, and cranes.
And as chief operating officer, you've become a bit of an expert in opening new buildings.
Well, we have an incredible team that helps to do that one, that's for sure. But, our first two ambulatory buildings at the Ohio State University Medical Center have been our outpatient care Dublin and our outpatient care New Albany facilities. Cancer has a relatively small presence in those two buildings currently. The next one that's going to be coming online this fall is actually in Powell. And there's going to be 2 whole floors for cancer. And that means our oncology services for infusion, as well as our examination rooms as well, and some supportive care services as well for the most common cancers. And that includes breast, colon, prostate, and lung cancer. The commitment there is that we want to make sure that we are delivering this high quality cancer care to our patients where they live and where they work. And in the suburban areas, I think that's how we are able to achieve that.
So I understand. So chemotherapy and infusions will be done there.
Correct.
And explain a little more of the other services that you mentioned.
Yeah. So if a patient needs a follow-up visit and they have one of those cancers, you can go to the Powell facility. And if they need chemotherapy, you can stay at that Powell facility. If you need rehabilitation services, physical therapy, you can stay in the Powell facility, genetics. So it's all the quality of care that's provided locally at the James that's distributed actually out into the community.
So some of the doctors, a lung cancer doctor, a breast cancer doctor, will have a clinic day set up there.
That's exactly
So they
right.
don't have to come to the Spielman or to the James.
So patients can
Okay,
stay
now I
closer to where they live and where they work.
Okay. And another thing I've heard about but don't fully understand is the James, which you mentioned before, is the James Cancer Network. You talked a little bit, it's here on campus, the surrounding suburban area, and out to rural hospitals. But let's talk a little more about that and how it even extends way beyond Ohio.
Yeah, so the James Cancer Network is a network of 7 hospitals that the James does not own, we do not manage, but we will ensure that we are able to deliver quality care in those communities. And so how that works is that we're physicians that are there that have very easy access to the physicians and our other experts at the James. We coordinate care back and forth to ensure that if there's needs for the patient that can be met in the local community, that's where the care is provided. If there's a need for tertiary or quaternary care, and by that means a higher level of care, complicated operations, specific types of clinical trials that can't be done in the community, the patient would then come here, and then the care is coordinated back to that local community as early as possible. So that ensures that the patients can be both seen here at the James and in their local community as well. That I think for everybody, it's a win.
So you say there's 7 hospitals. I don't know if you can name them, but just give me a sense of geographically where they are, what sort of counties or towns or cities where they are.
The way I think about it, if Columbus is at the center of the state, you can put a ring around that. And there are network sites in many of those locations, whether that's in Marysville, actually close by in Grove City is a network site. We've got them in Worcester, Ohio, towards the north as well. So it really does blanket the state.
And it's not that they don't have good doctors there. They're not a comprehensive cancer center. They're not a dedicated cancer hospital. So they may not have experts in every type of cancer, or they may not have ever seen a type of rare cancer that you and others here see all the time.
I think that's a great point, is that if you take cancer care, we know that more than 50% of all cancer care is provided in a community setting. And so we can't do all the care ourselves here at the James, nor should we. To be honest, that dyad partnership between a community program in a rural setting and an academic medical center that's a comprehensive cancer center and a dedicated cancer hospital is that perfect synergy. You take that single patient and you figure out what care is most appropriate to be delivered in the local area and what care is most appropriate to be delivered in the academic center. And that's, again, you expand the horizons or the ability to maximally care for that patient without that mandate that they come centrally here. We know that's hard on patients. And it's not necessary in all circumstances.
Over the years, I've met through Pelotonia and even here a couple patients from other states and even other countries. Explain how that happens and why that's a good thing.
Yeah, the James in the last year has cared for patients in all 50 states.
Wow.
And, almost 100 countries around the world as well. That happens through a variety of mechanisms. We have what's called a destination medicine program, which means that patients can call from out of our contiguous states or out of the country to work on getting records transferred, get an expert opinion from our physicians to see whether or not that patient should come to Columbus to receive some level of care. And then we also have just created what's called an online second opinion platform where providers that are across the country can actually refer their patients' records in for review by us to ensure that we're able to provide that opinion and care for patients that are outside of the area where our James doctors currently practice.
Wow. Have you see patients? What's the furthest patient has ever come to see you?
I have quote unquote seen a patient in Egypt, and I've quote unquote seen a patient in Asia as well.
Why are you saying quote unquote?
Because that was that online second opinion. Because the patients didn't come here.
Okay.
But we have seen patients for certain specialties. If you think about it, for very rare cancers, we've got incredible expertise in our gynecologic cancer program. We've got it in our sarcoma program, in our head and neck program, and so many more, that patients literally will travel halfway across the world to come to Columbus, Ohio to receive their care.
And isn't that also partly because you have clinical trials that are not available anywhere else?
Yeah, I appreciate you mentioning that one. And so we definitely, especially with our new commitment to cellular therapy or CAR T treatment, a type of immunotherapy, we are opening trials that do not exist anywhere else. And that opens up the opportunity for patients to be treated in ways that they can't in their local communities.
So I've learned a lot, and it's sort of expanded my vision of the James. I knew, about here in the West Campus and New Albany, but really you talk about just the whole concept and why it's so important to continue to always build and reach more people.
Yeah. So I would just say this, Steve, your mind has expanded. I think it's kind of similar to the James expanding or the way that we think about things. We know that the product that we're able to provide our patients is really exceptional. We're very proud of that. And we'd like that to extend outside of those that are currently in Columbus and able to access us. That means, again, it's our suburban ambulatory footprint. It's our network sites. It is our destination program, Second Opinion as well. So our goal is to create a cancer-free world. And the way to do that is to impact the greatest number of patients across the entire continuum, from prevention and screening to treatment, and then the home part as well. And if you can do that in our local community and beyond, I think then we're doing things right for our patients and their families.
What's it been like for you as the chief operating officer the past few years to be right in the center of creating these programs?
Yeah, so
and buildings.
It is a really exciting time in cancer care. Again, my goal would be to eliminate the need for any building. But for today, where the demand is certainly exceeding our supply, we have to try to keep up to deliver the high quality care. It's been really rewarding to me. And I'm not rewarded by seeing a building go up, but I'm rewarded by patients and families that come back and say, we had exceptional care, or we were able to access you in a way that I was surprised. But most importantly, it's that it's also done with a human touch. I think that the culture of the James has demonstrated consistently year over year to be so important.
Okay. I agree 100%, and good luck with the new facility in Powell and the one after that, which you probably can't tell us about yet, but I know you have lots more plans over the next decade.
Thanks, Steve. Appreciate the time.
This podcast is brought to you by the Ohio State University Comprehensive Cancer Center, Arthur G. James Cancer Hospital, and Richard J. Solove Research Institute. For more information, check out our website, cancer.osu.edu.